Drexel's community has answered the call for care, for testing, even now for figuring out about vaccination with city health officials. We've answered it internally with many of our own people. The overarching goal at the 50,000-foot view is to keep this campus with as low a risk of COVID infection, of COVID transmission as possible during the pandemic, and in so doing, have healthy campus operations and some semblance of campus life and academics here at Drexel. They are medical students volunteering. They are medical faculty who have come together to create a state-of-the-art lab where we can do state-of-the-art PCR COVID-19 testing right here at Drexel. College of Nursing and Health Professions, nurses, nurse practitioners, and others in various health professions, knowing that this is the time to come forward to the front line and care for people. The School of Public Health, where there are experts in epidemiology and the sciences who can work with us on the data, as well as practice experts that are guiding us. In sum, at Drexel, we've created a miniature public health department. We have wraparound services. We have behaviors that we want to reinforce, and the campus community right now is doing very, very well. It's critically important for students to be involved in these efforts. Students in public health, medicine, nursing, health professions, the health sciences, this is who they've chosen to be. Personally and professionally, many have a calling. At Drexel, you don't wait to become something. You don't come here and train to become something in your adult life. You are something and someone the minute you arrive.
I was surprised to see how interested your students were to engage in the system. They wanted to provide services to patients, to students. They wanted to partake in what we were trying to build. A lot of times it's our healthcare students that are helping provide these services and actually doing a lot of the testing. With our contact tracing and case investigation teams, a lot of the students that are hired to help with these investigations are actually public health students. So it's taken integration of a system to provide these services, but we do have students involved in every step of the way.
As a co-op, when people come in for registration, we ask them a little bit about themselves, their history, before we give them the actual COVID test. A lot of what I also do is answering a lot of the questions that come in through the COVID-19 hotline. The challenging part behind that is just learning how to accommodate to the changes. You know, at the COVID testing site, we come across issues every day. You kind of have to learn how to maneuver with it in the moment, and you have to do it in a way that you can kind of figure out a solution that won't cause another problem or won't cause another lasting problem.
I would say the most rewarding aspect of working at the COVID site at Drexel is that the campus and the school is literally only open because we are doing what we're doing. Today alone, we did close to 650 people, and we don't always have all the volunteers and all the faculty who are able to come in. So us co-ops, we're really working 9 to 5 all day, maybe a couple breaks here and there, but it's really time consuming and it can be draining, but knowing that we're helping the community is really beneficial.
What I do as a volunteer is meet with the university students who are coming in for testing, help instruct them how to administer a COVID-19 test on themselves. And after that, we take the specimens from them and it gets sent off to labs through the Student Health Center, and then the students are able to get their results. Before I started medical school, I thought about being a doctor as just being in a hospital and meeting with the patient. They have a disease and then you figure out what's wrong with them and then you treat it. But I've learned through the testing that the whole public health and community health aspect of it is super important. And just not just the patient in the room that you're dealing with the whole community.
Being a part of this testing has really allowed me to get that patient experience that I was looking for and that I feel like I'm missing, and really put patients at the forefront. And as someone who goes into medicine because I really care about the patient experience the most, this has been probably the most valuable part of my first year experience.
We collect all the information and then we divide them into whether they are somebody who is an actual case or if there's somebody who was an exposure, and we initially call them and do their intake, and then all necessary follow-up that needs to be done. And we also give resources while they're in quarantine, like how are you going to get your food? What is your living situation? You know, do you have another person in your house? Do you share bathrooms? Counseling resources, because in isolation and quarantine actually is mentally taxing on a lot of people. They're scared. They don't know where to turn for help. So checking in every day is a person-to-person contact.
As the lead contact tracer for the COVID surveillance project, I lead a team of 6. It's a mix of undergrads as well as Drexel staff that decided to come on and help us. With that team, we work from 9 a.m. in the morning until 8 p.m. Monday through Friday, as well as Saturday and Sundays. Students will go into the testing site at Race Hall or Queen Lane, and then when we get those results, we'll conduct contact tracing on that case, who they've come in contact with in the past 24 to 76 hours at some time. We ask them, how many feet away were you? Were you outside? Were you inside? Were you wearing a mask? Was it a cloth mask? Was it an N95? So really it's an investigation. That's the bulk of our work. We also work very closely with Philadelphia's health department, as well as the other neighboring colleges. So in my opinion, that's where public health and medicine come together, because we're able to navigate these students in the right direction and help them really to make a plan that fits their life, that fits their culture, that fits their background.
I'm the lead case investigator here at Drexel for our COVID surveillance project. So I have a team of about 5 case investigators, and what we do is conduct case investigations for anybody on campus who might test positive or who have already tested positive, while assessing exposure, assessing risk, and providing information to our students on how to prevent any possible exposures and positive cases. In addition to working with the public health department and other institutions in our area, we use the data that we collect from our case investigations to analyze where the exposures are coming from, where the cases are coming from, and then we work together on possible solutions for how to improve our data and how to improve our numbers. It's inspired me to focus on how I can be a support to patients in the future. It's still premature to know exactly where I'll be in medicine, but I do know I want to work in public health, and I do know that I want to build really close relationships with my patients so that I can be a support for them during life, and no matter what it brings them.
Probably more important than anything is our students learn how to serve their community, but they also learn how to serve the community abroad. So we're teaching our students here, and they're teaching each other how to be good neighbors. I think that just as many of us have been pushed to the limit with those capacities through COVID, I think our students have as well. I am just so incredibly proud and astonished at the resilience of our students, that every single time we've given them a task to do and a barrier to surpass to get the job done, they've always done it.
We often say every day is Blur's Day when it comes to COVID work. Things are happening so fast, but that we are moving through it and we are close to coming out of it. We are so close to coming out of it. And my hope as we move forward is that what we learn from our new teams for how we've come together to face this issue at Drexel, that those lessons learned will carry forward to the way we approach problems moving into the future at Drexel.